Hi.
Hi.
My name is Lisa Ziomek. I'm a nurse practitioner student at Grand Canyon, and I'm going to be doing your physical assessment and interview today.
All right.
Okay?
Yes.
First, let me perform my hand hygiene and assemble my equipment. And now, can you tell me some things? I'm going to get some patient information. What is your name, age, date of birth?
My name is Olga Ponce de Leon. I'm 89 years old. What else did you want to know?
Your date of birth?
7535.
Happy birthday recently.
Yes.
And then, what is your nationality?
I was born in America, but of Mexico-born parents, so that makes me Mexican-American, I guess.
Yes, okay. And how do you identify? As a female or male?
Female, all the way.
Okay. And what brings you in today? You have an earache, or how about that?
Okay, I've had problems hearing. I don't know why.
Okay. Well, I'm going to be going through an exam, and we'll see if we can't get to the bottom of that. So now I'm going to obtain the history of your present illness using OPQRST. So for O, onset, when did your hearing problems begin?
About 8 months ago.
Okay. And for P, does anything make it better or worse? It's palliative or provocative?
I haven't really studied it too much. I really don't know.
Okay. And then what's the quality of it? Is it muffled, or can you hear certain tones? Does it sound full?
I just know that I miss a lot, and
In conversation, do you mean?
yes, I ask them to repeat.
Okay.
And sometimes on TV, I'll ask somebody else, what did they say? It's I don't know if it's my hearing or my understanding.
Okay. Do you notice that it's in certain ranges of tone, higher pitched tones or lower pitched tones, or is it more in the middle range?
I can't really answer that.
Okay. Okay. And then, is it one ear or is it both ears? Is it bilateral or one ear more than the other?
I haven't noticed that either. I mean, I haven't tested,
Okay. Okay. And then for severity, so if 0 was I can hear everything perfectly fine, and 10 is I can't hear anything at all, where would you put your hearing problem?
I'd say maybe 7.
Okay. Okay. And then is that constant, or do you ever notice that it comes and goes?
It comes and goes because I haven't really studied it that much.
Okay. All right. So that was HPI. Now we're going to do some of your past medical history. And so, do you have any, how would you perceive your general health?
I consider myself to be healthy at my age because I could walk around and enjoy life.
Okay.
So I really can't complain too much.
Okay. Do you have any history of neuro disorders like stroke or migraines?
No.
Do you have any psych history?
At one time I was very nervous because I went through a divorce.
Okay. Were you prescribed any medication?
Yes, a tranquilizer to sleep.
Were you hospitalized for that?
No.
Okay. Have you ever been hospitalized for anything psych?
No, just backaches and babies.
Okay. How many babies have you had?
3. And 1 miscarriage.
Okay. So you've been pregnant 4 times and you've delivered 3 babies, all vaginal deliveries?
Yes.
Okay. While we're on the topic, I'll just keep going here. When was your last gynecological exam? I imagine you're postmenopausal at 89. Do you still see a gynecologist?
No.
Okay. And
it's been many years. My doctor said I didn't have to anymore.
okay.
And that's been some years back.
Okay, wonderful. So let's see, we're in past medical history, neuro, psych, and we got into the gynecological exam. Okay, so let's go back up to where we detoured. Do you have any history of anything in your head, problems in your head or with your eyes or your ears? I know we're here to talk about the hearing loss. But do you have any frequent earaches or frequent nosebleeds or difficulty swallowing?
No.
Okay. And do
I
you...
wear glasses for reading.
Okay. No cataracts or lens problems?
No, I had cataract surgery years ago.
Okay. And so you wear glasses for reading?
Yes.
Okay. When was your last eye exam?
About 2 years ago.
Do you normally go annually, or how often do you go?
Doctor said I didn't have to go annually. Every 2 years is fine.
Okay. When was the last time you saw your regular doctor for a physical exam? When was your last physical?
Maybe about a year and a half.
Okay. How often do you see your doctor? Every year and a half or so? Every 5 years?
I don't go very often. I know that.
Okay. Okay. And then, so let's see, we got your last eye exam. Now, what about the dentist? Do you have any problems in your mouth chewing? Any pain when you chew? This is...
No.
Wait a minute. I'm more in a review of systems than past medical history. I do this a lot. Thank you. Wait, let me rewind because I veered off track there. So in past medical history, do you have any history of cough? Any history of anything? Any coughs? Or shortness of breath or difficulty swallowing? Any history of chest pain, palpitations, shortness of breath?
No.
Any history of GI or GU problems like difficulty going to the bathroom, constipation, bowel surgeries, anything like that?
Years ago I did. Many years ago.
Okay, with what? Which part?
Well, I would leak.
Okay. What did you have done about it?
I went to see a gynecologist, or a urologist, a urologist.
Okay.
And he said I looked healthy. He said, maybe, do you think it's nerves? I said, I don't know.
Okay.
I checked out okay, and I think it just cured itself. I don't know, and he told me I was okay.
I'm back on track now.
Okay.
Do you have any past medical history of any allergies to medications, substances, or drugs?
I have one allergy to sulfa.
Okay, what happens when you have sulfa?
I get itchy around the mouth, and
Do you have a like a rash? Does a rash ever show up? Is it hives, splotchy?
I don't remember. I've been away from it for so long. Yeah.
Okay. And then no allergies to substances, or the environment or other substances?
No.
Okay. Have you ever had an infectious disease?
No.
Are your immunizations up to date?
Yes.
Do you get an annual flu or COVID vaccine?
Yes.
Okay. Any chronic illnesses?
No.
Okay. Hospitalizations or other injuries? Have you been hospitalized?
No. I've had just carpal tunnel
Okay.
and bunion removals.
Okay.
Toes straightened. That's about
Okay.
it.
Did you have anesthesia for those procedures?
No, just locals.
Okay. Have you ever had anesthesia?
I don't remember.
Okay. Okay.
I don't think so. Maybe once. I don't know.
Okay. So you
don't
likely didn't have complications from
No.
those. Okay. So we're in past medical history and we just went through. Do you take any medications on a regular basis?
Thyroid.
Okay.
Lowest dose of the most popular one, low.
Levothyroxine?
Mm-hmm.
Okay. So do you have a history of hypothyroid? Do you still have your thyroid? Yeah?
Yes.
Okay, so you have hypothyroid. Now let's see. Past medical history. Now we'll do your social history. Did I get everything in that one? Medical history? Don't tell me. I'm moving on. Surgical. Okay, so social history. Do you smoke, drink, or do any drugs?
No.
Do you stay adequately hydrated?
That's it's a problem with me.
Okay.
I have to be reminded to drink enough water.
Okay.
But I consider milk and coffee and soda pop as drink.
Yeah, but it needs
But
to be
I'm
water.
bad about water.
Okay. What is your nutritional status? Do you eat 3 meals a day or?
One big meal and a light breakfast usually,
Okay.
and a light dinner.
Do you drink a lot of caffeine?
No, just in the morning.
Do you ever have to use laxatives?
Very rarely.
Okay. When was the last time you used a laxative?
2 years ago, a
Okay.
gentle laxative. I
Okay.
never get.
Just to help move things along.
Mhm.
Okay. So I got off track there for a second. Social history, we talked about laxatives, hydration, nutrition. What kind of home do you live in? Is it a single level or are there stairs in the home?
Yes, there's a basement where I have to go down to do the laundry.
Okay. And so stairs, do you have any trouble with those stairs?
It has a banister, so
Okay.
I always hold on.
And then do you have a job? You're retired? Do you live at home?
Yes, I'm retired.
Yes, this question, how I would ask somebody of a working age, not retired, would be, does your income support your your lifestyle? So does your retirement support your lifestyle?
I'd say so because my house is paid for.
Oh, excellent. Okay, that's great news. How was your emotional stress? That must relieve some financial stress. Do you have, how would you describe your stress level?
Oh, when the house needs repairs, and I worry then that some expensive repairs might set me, back.
Okay. Do you live alone?
I live with a daughter that cannot work full time.
Okay.
She helps me with some of the expenses.
Okay. Hang on a second. Let me dig back in my file there, because we're in social history. Have you ever served in the military?
No.
Let's see. Oh my gosh, I think I forgot family history. Okay, so where were you born?
I was born in East Chicago, Indiana.
Okay. What's your education level? What did you do? Tell me about your...
Graduated from high school and then went to beauty school for about a year.
Okay.
So I have a beautician's license.
Okay.
But it's been expired for years.
Okay. Now I'm going to ask about your your activities and hobbies. Do you exercise?
I used to, but not
In
too
a
much.
while?
No.
The stairs, though, that's some
Yes,
exercise.
I consider that exercise.
Okay, I agree. And then, how do you sleep at night? Do you sleep well?
Yes.
You sleep well?
For the most part, yes.
Okay. That was habits. Okay, and then I skipped over something in your medical history, I'm going to ask you some sensitive questions about your sexual history. Are you sexually active?
No.
Okay. Perfect. Do you have any history of sexually transmitted diseases?
No.
Okay. Okay, we're done with that one. All right, so now let's go into the verbal review. No, your family history. So for these questions, I am going to be asking, I want you to think about your maternal and paternal grandparents and your mom and dad, and then your siblings and your children. So first of all, are any of your parents or grandparents living? Probably.
No.
Okay. Did any of them die at a very young age? What were the ages and causes of death, if you remember?
Well, my dad, it was his heart.
Mm-hmm.
And my mom, she had a breast removed because of cancer, but I'm not sure what I could call her death as.
Cardiac.
Her heart
Congestive
stopped.
heart failure.
Congestive heart failure. At age 84.
Okay. And
My dad died at 80 with a heart attack.
Okay. And what about your their parents on both sides? Well, at 89 though, that's not a level that we really need to worry about. So now more about your siblings, or how many siblings do you have?
I have 3.
3. And are they all living?
No, one died.
And what did he pass from?
Pancreatic cancer.
How old was he when he passed?
He was 69.
Okay. And your children? You have 3.
Yes.
And they're all living, and how is their general health?
I think pretty good.
Okay. So for all of these people, I want you to think about all of these people, and we're going to go through each of the types of medical history that you might share. Are there any we'll start broadly, are there any genetic disorders?
I don't think so.
Any history of obesity?
No.
Any musculoskeletal range of motion, arthritis?
I don't think
Any
so.
history of that with any of those folks? Any diabetes or others with thyroid problems?
I think I only have one daughter that has suffered a divorce. She married too young, and it affected her stability
Okay.
to work and to
So that's more of a
psychological setback, yes. And
Okay.
I took her in because a divorce happened then.
Okay. And then do any of those people have any neurological history? Again, strokes or migraines or anything of that nature? And then for them, do they have any problems with their head, eye, ears, nose, or throat? Blindness, glaucoma?
Not that I know of.
Okay. And then for all of those folks, any cardiac or respiratory problems, history of any infectious disease, tuberculosis, pneumonia, or cancer of the lungs. You've had pancreatic cancer and breast cancer.
Yes.
Any other cancers in your family?
Not that I know of.
Okay. And then for bowel and bladder, any bowel or bladder history for any of those people? Kidney disease, end-stage renal disease, dialysis?
Well, I have one daughter that has lived in another city, and of course she doesn't confide in me about her medical problems. That's Laura.
Okay. Okay.
But the others live close to me, and they haven't had hospitalizations or serious health
Infectious
problems,
disease.
infectious or anything like that.
Do any of them have any addiction problems or substance abuse problems?
No.
Okay, good. All right, and we were in I bounced around a little there, and I already asked about musculoskeletal, obesity, infectious disease, does anybody have any lymphatic history, lymph disease, or hematology problems?
I don't think so.
Okay, so now we're going to go into a verbal review of all of your systems, where we're just going to talk about how they are right now. Okay, so do you have any, how do you perceive your general health?
I think I'm in pretty good health for my age.
Okay, good. And you feel good today?
Yes.
Okay. Do you have any dizziness problems?
Every now and then, if I move pretty fast from
Sitting to standing?
sitting, yes, and I can't.
Not to wag my finger at you, Auntie Olga. That might be related to your hydration, your poor hydration status that you confided in me. When you stand up too fast like that, you think of gravity pulling all of your fluid to the ground away from your brain, so it's going to make you lightheaded and dizzy. So more reason to drink liquids, but water is really the spice of life.
I'm glad you're giving me that advice because I've heard it and I need to hear it more.
Okay, good.
Thank you.
Thank you for coming in today. Okay, so back to us. So any anxiety or depression or feeling down or sad for prolonged periods of time?
Not really.
Okay, like over the last 2 weeks?
No.
Okay. And then do you have any eye floaters or blurred vision?
Occasionally I get those floaters, but they disappear.
Okay.
The doctor said not to worry about it.
Okay. Any runny nose or bloody nose?
No.
Any ear pain or
No.
anything out of your ears?
No.
Problems chewing?
Well, I'm missing quite a few molars, so I know I have to chew carefully and longer than
Good.
if I
If
I
you-
had all my teeth.
Okay.
But I live with it and I don't choke.
Okay.
I mean, I don't eat fast. I eat slow and careful.
Did we talk about when was your last dental exam?
Within a year, I think.
Oh, good. Do you do that annually? Do you get your teeth cleaned?
I do. I try to at least once every 2 years, if not
Okay.
every year.
Do you have any implants or oral surgery?
No, just missing.
Just missing some of those
molars, yeah.
Okay. Any difficulty swallowing?
No.
Okay. And I don't. Well, I got ahead of myself there. And we talked about your hearing problems. Do you ever get ringing in your ears? Or okay. Any range of motion problems or pain in any of your joints?
Well, at my age, sometimes I do get upper arm pain,
Okay.
but it's because I think I'm more.
You feel it in the bone or in the muscle?
I can't tell the difference.
And I didn't mean to interrupt you.
That's all right.
Why do you think that is?
Because I stay still too long.
Okay.
I like to read and I like to sit and watch TV. And if you stay too still, you
Sedentary.
get achy when you start moving.
Yes. Okay.
Like I want to freeze or something.
Okay. And then now in your chest, heart and lungs, do you get any chest pain? Do you ever feel palpitations or just, skip beats?
I don't think so. Only if I get frightened or something. Then my
Startled?
heart, startled or something.
Okay. Do you get any shortness of breath when you walk any distances?
No.
Okay. And no cough recently?
No.
Okay. And then bowel and bladder again. Do you have any dribbling now or any frequency, urgency?
I don't.
Burning?
I'm fortunate that I don't have those kind of problems.
Okay.
But I do get constipated every now and then. And I
Okay.
think it's because of the lack of liquid.
Probably. How long do you feel, do you know about how long your constipation lasts? Like 3 days, 2 days? How many days before you seek out a gentle laxative?
If I don't go 2 days, I'll take a gentle laxative. Because
Okay.
I know that you
Yes.
should.
I'm happy to hear you say that. Once we get beyond age 65, at 5 days, you really need to. 3 days is good to take care of it, but by 5 days, if it hasn't been handled, we have to handle it because now we're risking impaction,
Right.
and we don't want that.
Yeah, I've heard of friends that have had that, and they warn me.
It's not pleasant.
It's not pleasant.
Okay, good. When you do go normally, when you're not constipated, do you go every day?
I
You have a
think
bowel
so.
movement
Yes,
every day?
yes.
Is it soft and formed and a pretty color brown?
I haven't studied it, but I feel better.
Okay, well, believe it or not, that is a very telltale sign of how our health is.
Yeah, I understand. I've heard that
We could talk forever about it.
if you have very dark stools, there may be blood in it.
That's correct, and that was going to be my next question. Do you see and ever see any blood in your urine or stool?
No.
Okay. Any nausea, vomiting, or diarrhea? Okay. So now let's talk about. You know what I had? I skipped general survey. No, I didn't. But do let me ask you about your skin. Have you noticed any new moles or bumps or nodules or purpuric lesions? Your new moles that you've been worried about?
No.
If you were, I would evaluate those using A, B, C, D, E. Area, border, color, diameter, and evolution. So, like my mom's birthmark that she has on her wrist.
yeah,
Remember
she
how
had-
it used to be very small?
Yeah.
And it started to grow?
Yes.
So that would be something that fell into that category.
Okay.
But we'll take a closer... Yeah, she has one just like that.
It doesn't
Did yours
bother
get
me.
bigger like that? Hers doesn't bother her either, but... Okay. All right, we'll look at that in a little bit. We're still just talking right now.
Okay.
So let's see, we did skin. Do you get hot or cold at night? Do you ever get night sweats?
I do sometimes,
You do?
but rarely.
Okay. Have you had any unintentional weight loss or gain?
I don't think so.
Okay. Do you have any, do you get sick easily?
No.
Do you bruise easily?
Sometimes.
Okay. All right, so that was verbal review of systems, and now we're going to go into the general survey. So for this, I am looking at a elderly female who appears in no distress. The rate of breathing is regular and normal. Her face is symmetrical. Her skin is warm. It appears, what I can see of her skin, the hair distribution is negligent. You have no hair on your arms, but the hair distribution on her head is within nationality, within her ethnicity, normal limits. There was something we're supposed to say about is like commensurate with the nationality, as expected. Posture is upright. Eye contact is good. She is alert and oriented ×4 for her level of consciousness. She is behavior, attitude, and affect are all appropriate. And I I talked about regular rate and rhythm, no acute distress. I'm gonna, respiratory rate is regular and normal. What about it? She walked into the room with a normal gait. She has good hygiene and she does not smell. She is not malodorous. Okay, and now, so from that we're gonna go now into the general survey. So now I'm inspecting what I can of your hair, skin, and nails, which I did a little bit just a moment ago. I'm gonna look at your skin. What I see, they're warm, and since you have your beautiful nails are painted, I'm gonna check your cap refill in your fingers here. It's within 3 seconds. That's good. We're gonna continue on with some of that, but there's no cyanosis, pallor, jaundice, swelling, erythema. There's no tremors noted. There's minor muscle atrophy, but that's commensurate with your age. Now that I use that word, I'm going to use it another time. So that was hair, skin, and nails. Do you do your own breast self-exam?
Rarely.
Rarely. Have you had a mammogram?
I haven't. It hasn't been required of me. They told me I don't have to anymore.
Okay, but you had them. You had
Yeah,
screenings.
I had them in my younger years. Yes.
Okay. And now we can move into the physical exam.
The initial physical exam, you didn't finish that. You just did general appearance.
But that's the general survey, and then next group should be.
The skin and the hair.
Yeah, that's what I did. But when I go in to perform it, that's okay. That's where I'm going next. Okay, so now I can perform my physical exam. There's so much repetition in some of those questions between your past medical history, your family medical history, and a verbal review of systems. I have to ask the same questions 3 times, so I get a little shuffled in there.
Mm-hmm.
But now we're going to move into perform the exam.
Okay.
Okay, are you ready?
Yes.
Okay. So I'm going to assess your head. Your head is normal, cephalic and atraumatic. I don't feel any protrusions. I'm going to look into your hair. It's of normal texture. It is well distributed. There are no inhabitants. Let me look at you. And her face is symmetrical. She's beautiful skin. I'm going to feel her occipital lymph nodes while I'm back here and come forward to the preauricular, the postauricular. I'm going to oh, I know what I forgot. I got to go back. Sorry. During the general survey, I need to ask my evaluator for your vital signs and your height and weight, and also your Snellen chart.
Go back to that page.
Thank you, sorry. And ask for your Snellen chart exam, which was already obtained for you. This will let me know that your cranial nerve 2, your optic nerve, is intact.
Okay.
Okay, and then, so that was in the general survey. So now we're in the head, eyes, ears, nose, and throat exam, where I palpated your head.
Right.
It's normal cephalic, atraumatic. Hair distribution is normal, and there are no inhabitants, no dandruff, no flakiness. And now we're going to look at your face. Your your face is symmetrical. There's no swelling noted. There's no edema or tremor or that. Hang on a second, I didn't want to lose my scoop over just a little touch there. There we go, so I can face you for some of this. Okay, good. So now I'm inspecting your eyes, your conjunctiva, your sclera, your lens, your pupils, your cornea. And I'm going to pull down, and will you look up? Conjunctiva, okay, and I'm going to pull these up and look down. Oops, hang on one second. Good, conjunctiva are a little pale, they're pink. I'm going to have you raise your eyebrows. Good, and clench your eyes closed. That's just because I was right there. Okay, that's good. And can you feel me touching?
Mm-hmm.
I'm out of order.
Mm-hmm.
I know I am. Okay, you felt me touching and it's equal on both sides? Good. Now I'm going to assess your pupillary response. So I'm going to shine a little light in your eye. Good, that one's equal, round, and reactive to light. and we've got a consensual response. And if you can follow my pen, we're gonna do external ocular movements. That is cranial nerve 6 and 3, coming down to the midline is trochlear, cranial nerve 4, and then we're gonna go up into these fields. Okay, good. And so there was no nystagmus. So cranial nerves 3, 4, and 6, which is ocular motor, trochlear, and abducens are all intact. Now I'm going to look at my ophthalmoscope with you. I'm gonna shine a little light in your eyes. Not for long because we don't dilate your pupils and it's hard to see. But with my ophthalmoscope, I'm going to open your left eye. Hang on a second. I forgot to put a timer on to see how long I'm doing. Okay. All right, and now I got the red reflex, and if you can look at the tip of my right ear, there we go. I see a vessel, I'm following it in, and now I see the fovea and macula visualized, and the disc to cup ratio is 1:3, which is normal. And now I'm gonna check this left side. Oops, sorry. Good. And red reflex, 1:3. 1:3 disc to cup ratio. Okay, good. So that is that one. Okay, let me think for a second. So that was, we did the head, we did the eyes. Now I'm looking at your ears. Back to your eyes. They're pink and MOIST. Their sclera are white. The sclera is not icteric, jaundiced erythema. There's no subconjunctival hemorrhage, no drainage noted in your eyes at all. So now let's look at your ears. There's no drainage noted. When I touch right here, does it hurt?
No.
Okay. And what about over here?
No.
Okay. While I'm here, I'm gonna palpate your temporal arteries, 2+, and I'm gonna roll, checking for cords that would indicate temporal arteritis, and there are none. I'm gonna occlude this ear, and now I'm gonna check your hearing. Repeat after me, okay?
Mm-hmm. ABC.
Good, that's the whisper test. And now this is the ear that bothers you, right?
Mm-hmm.
Okay.
XYZ.
Very good. The next one we're gonna do is the Rinne exam. So with this tuning fork, I'm gonna hold it to your mastoid bone, and I'm gonna take a watch and I'm gonna count. And when you stop hearing it, then I'm gonna move it to the air, and I wanna know when you stop hearing it count. And that should be a 2-to-1 ratio of air over bone conduction. Okay?
So I start counting?
I will. I worry about the counting. You tell me when you stop hearing it. Oops, hang on a second. My finger was touching it. Oops. There we go. Hear it?
It's gone.
Dawn? All right, now when do you stop hearing it?
It's gone.
Good. 2-to-1 is normal. And then I would do the same thing on this side, but I only need to do it once.
Okay.
But I would, if we were doing this for real, I would really be doing a hearing exam, and I would refer you to an audiologist. Okay. Now I'm going to check the Weber, and this is, do you hear it equally on both sides?
I think it's louder here.
It is louder there?
I think.
Okay. That's something.
Excellent finding,
Yeah.
student.
Thank you. So we would document that it's louder in her left ear, and that's the ear with the problem. Air to bone conduction was 2-to-1, which is normal. Now I'm going to look with my otoscope into your ears, and this way. And there's no blockage, no wax noted. I see the TMs are pearly gray. The cone of light is visible, as are the incus and the malleolus. And now let me check in this ear.
Malleolus, but who's that?
What did I didn't say it right?
You said malleolus.
Like the ankle?
Malleolus.
Malleolus. Okay. I have been corrected. Okay, so in the left ear, I see No scar tissue on the TMs, they're pearly gray. The conolite was visible, as were the malleolus. Say it again.
Malleolus.
Malleolus. The malleolus.
That's the way I learned it.
And the incus, which are your ear bones. Okay, and then, so we also assessed your hearing, which is cranial nerve 8, the vestibulocochlear nerve. So that is intact. Now we're gonna move on to, yes, while I was here, I got a couple more things to do while I was here. So I palpated those. I'm gonna palpate your sinuses now. Do you feel any pressure when I push?
Mm-mm.
Okay, those are, that's good. And then I already assessed this, but I'm just gonna do it one more time. You feel me touching you equally?
Mm-hmm.
Okay, and then can you open your jaw? Open. Good, and close. Good, and clench down. Okay, good. And can you move your jaw side to side and forward and back? Good. Okay, you've got good range of motion in your jaw, no TMJ. Also no, and one more thing, big smile. Show me your teeth. Good. Puff out your cheeks. Good. And stick your tongue out at me. Good. And move it side to side. Good. And then can you also stick out your tongue at me and say, ah?
Ah.
Oops, hang on, sorry, one more time. There we go.
Ah.
Okay, good. So I saw the uvula raise and the soft and hard palate. And can you swallow for me? Good. So now let's talk about the cranial nerves. Oh, one more. Well, we're getting to the nose, but before, I'm going to ask you this because we're talking about the nerves right now. Tell me if you can smell this.
Mm-hmm.
Yeah? Good. Doesn't it smell good?
Mm-hmm.
It's called perfect.
Mm.
Okay. So cranial nerve 1, your olfactory nerve is intact. Cranial nerve 2 is intact, as indicated by your Snellen chart. Cranial nerves 3, 4, and 6 are your EOMs, and those are intact. That's ocular motor, trochlear, and 6 abducens. Cranial nerve 5, your facial nerve is intact. We tested that with sensation, and then the bite down and the lateral jaw movement, so that's intact. We were on number 306 is the lateral rectus muscle control in the EOMs, and then now we're on 7, which is the facial nerve. When you raised your eyebrows and smiled for me and clenched down, that's cranial nerve 7. So that is intact. 8, vestibulocochlear was intact. 9, glossopharyngeal, and 10, all working together to swallow, which is adequate for me. However, it could also be assessed by the gag reflex. That's the vagus nerve, which we're not going to do. And then if you can raise your shoulders for me, good. And then don't let me push down, or go ahead and raise them again. Okay, good. And then can you push against my hand? Good. And this side? Good. So that's cranial nerve 11, the spinal accessory nerve, and that is also intact. Cranial nerve 12 is intact because your tongue is midline with no deviation. So we just worked all of those cranial nerves. Now I'm going to go back to your nose. Okay.
Very good so far.
Okay. So now I'm going to look at your nose and we're going to test your nasal patency. Can you plug one side? Good. And then plug and very good. And now I'm going to look up your nose and wait a minute. Let me turn my little light on. And I visualize your turbinates. They are pink and moist. They are not boggy. And I see the anterior and medial turbinates. There's no drainage noted. And patency we checked. So now we're going to look at your mouth. What was it? And we're going to look at your... No, I not quite. I got to look and check out this dentition. Yes, I see some missing molars. There's no leukoplakia. I see the soft and hard palate. Stick out your tongue for me and say, ah. Did you have your tonsils removed? No, they're there. They're 1+, and I saw the anterior and posterior pillars of the tonsils. The tonsils are 1+ bilaterally. The buccal mucosa is pink and moist. There are no fissures at the vermilion, fissures or lesions at the corners of the mouth or the vermilion border. That's about it. Okay, and now the neck. Okay, so your neck is symmetrical. There is no bulges. There is a little bit of a bulge here, but that looks like it's muscular. I mean, bone, which we'll look further into this in a minute. like I said, there's no goiters or asymmetry. The neck is soft and supple. I'm going to check the preauricular lymph nodes, now to the posterior auricular, the tonsillar, the submandibular, the submental, the anterior cervical chain, posterior cervical chain, suprascapular while I'm here. But because I am inspecting this asymmetry of your right collarbone, have you ever broken this?
Mm-mm.
Have you ever noticed that this is a little bigger on that side than the other?
Mm-mm.
No, so this I would document in my musculoskeletal assessment. I'm palpating to the acromion process, and we will engage with that when we get to the chest and the musculoskeletal. So back to the neck, I'm assessing for tracheal deviation, and it is midline. Carotid pulse is 2+. This carotid pulse is 2+. I'm going to come from behind and ask you to swallow. Swallow. Good. And no pain. That was assessing your thyroid. And I'm just going to do one more thing. There's no nodules noted. And okay. No pain or tenderness when I palpated that. Okay. And no difficulty swallowing. Okay. I think that's it for the... I checked it when I checked her head.
You didn't say it.
Oh, I did when I checked her head, but I'll say it
I
again.
didn't hear you.
I said I'm also checking the occipital lymph node while I'm back here during the normocephalic atraumatic section. Huh? Thank you. Give me that point. Okay. So that was head, eye, ears, nose, and throat. Now comes the fun part where we're going to be doing chest, abdomen, and musculoskeletal. I'll be looking at the front and the back and listening and percussing a lot of areas and also palpating a lot of areas. So we'll be doing some sitting down, and then we'll be doing some lying down, and we'll sit back up and do some walking, and then we'll be done. Sound good? Okay. So for this, I'm assessing what I can see. This, you would be in a gown, and hopefully we have to do skin-to-skin contact with stethoscopes. I'm just verbalizing these things. So back to inspecting the chest, there's regular rate and rhythm of breathing. I'm gonna come to the posterior thorax, and that's okay, you stay put, Auntie Olga. And I'm gonna palpate. Do you have any pain to any of this area? Okay, and then, okay, go ahead and shift up and that way, and that way. Perfect. I'm gonna put my thumbs at about the 10th rib and ask you to take a deep breath. Good. I'm watching my thumbs move, and it's equidistant, about 2 inches. Good. Now I'm going, that's thoracic expansion, and now I'm going to percuss across the lung apices above between the first and second intercostal rib. I'm going to move down. All of this would be doing skin to skin, so just resonance. Resonance. Are you ticklish?
No.
Okay. Yeah, there we go. There we go. Okay, and one more. Okay, good. Now I'm going to assess for diaphragmatic excursion. So let me tap until I hear dullness, and then ask you to take a deep breath. Resonance, resonance. Okay, and diaphragmatic excursion is normal at about 2 to 3 inches. Now I'm going to ask you to repeat after me and say 99. This is for tactile fremitus.
99.
Good.
99.
Good.
99.
Good.
99.
Okay, so that's tactile fremitus, and that was normal. So we did diaphragmatic excursion, tactile fremitus, we palpated, and now we are going to listen. I'm going to auscultate too, with the diaphragm and 8 areas. So deep breath. We're going to do about 8 breaths, and you don't have to hold it. Just keep breathing 8 breaths. Good. Good. Wait, let's Here we go. Good. Oops, hang on. Okay, go ahead. Good, nice and clear. Okay, good. All right, your lungs are nice and clear. All right, so now let's face forward, and I'm going to do the same thing on the front. You can face me, thank you. So I'm going to percuss these areas of your chest. Thank you. And come under your arm, I would be, and then let me see. That's actually where your spleen is, through there. And your liver is on that side. Okay, now I'm assessing for heaves and thrills. I'll have you say 99 again.
99.
Good.
99.
Good.
99. 99.
Good. So that was that, and then I did that, and I listened already. So wait, did I listen? I didn't listen yet. Let me do that listening again with the diaphragm. And we're going to do 8 breaths again. Good. Okay, hang on a second. Let me get the, there we go. And then we're going to come down. Sorry, Auntie Olga.
No.
Okay. We're making it work here.
Bentley.
Okay. Okay. Bentley. Okay. All right. And now
Bentley.
lie down. Lie down. Lie down. Stay. So now I'm going to listen to your heart while I'm here. Also, second intercostal space here with the diaphragm is your aortic valve. No murmurs. No extra clicks. Now we're listening to the pulmonic and the second intercostal space, left lateral border. Erb's point, that third ICS. Now the tricuspid, 4 to 5, left lateral border. And the point of maximum impact. Oops, hang on a second. And you can breathe normally, Auntie Olga, I'm sorry. And then the mitral valve. And I'm also going to listen. Now we're going to flip it over and listen with our bell. Wait a minute. I'm going to listen to your carotid arteries. No bruit or thrill. And bronchovesicular sounds heard. I can't remember that one. And now I'm switching to the bell for bruit. No bruits. And then we're going back to aortic, pulmonic, Erb's point, tricuspid, mitral valve. And then I'm going to listen for 20 beats at the point of maximum impact. Okay. All right, and now I assessed your carotid pulses. Those were 2+. So if you, let me put this pillow. If you don't mind laying down, we're gonna do those heart sounds again with you laying down. Okay, fit there. Yeah. Cover you up with my. Here we go. Is that comfortable? Yeah. Okay. Let me come down a little more so I'm not towering above you. Okay, let me listen again. We're going to go back to the diaphragm and listen to your aortic, pulmonic, and I'm gonna do this so on the outside. I would be doing this there, but so you can see my location. Herbs point, tricuspid, mitral, and then PMI, and then back through with the bell. Okay. While I am here, and I have my ears in, I'm inspecting the belly, and I do not see any hernias or protrusions. It's just a soft belly and flat. It's not round or protuberant. But while I have my bell and my stethoscope, I'm going to listen to her renal arteries for bruit. And I'm going to listen to the iliac arteries and the femoral pulse. I'm palpating, nice strong pulse. I'm also palpating the lymph nodes that are there, and I do not feel any lumps or mobile lymph nodes. Pulse is present. And no bruit. And then we're going to flip to the diaphragm and go back through. Okay. Iliac. Okay. Okay, no bruits noted in any of those. So we have assessed all of the valves of your heart and your major arteries, your aorta, diaphragm, and bell. There's no pulsations, but we were also in the abdomen, so that, oh, I kind of jumped ahead of, I know. I need some feedback from my teacher, please.
You want feedback?
In a minute, because I have got I've kind of the, anyway, so I inspected, I auscultate before I palpate and percuss. Anyway, so that's that.
Okay.
Now I'm going to percuss across 4 areas, and I'm just going to go straight across, and I hear tympanic sounds. And now we're going here. Is your bladder full?
Ooh.
Okay, so that was the all 4 bladder areas. I'm also going to assess for the liver span. So, or no, I'm sorry. I'm going to lightly palpate and want to know if you have any pain or tenderness.
Mm-mm.
Okay. And now I'm going to do a more deep palpation when you take a deep breath to assess your liver. One more time. Okay, the liver did not drop, but I'm also going to percuss this area for liver span until I get to adult area. And normal span is 8 to 10. Also, while I'm here, I'm going to assess Murphy's sign. So if you can take a deep breath again. Any pain on deep palpation there would indicate a possible biliary tree problem. Over here, I would walk around to the other side of the bed, and we're going to assess your spleen, which is right here. I can hear the dullness through there. And then I'm going to palpate it, and I should not be able to feel it, and I don't. I'm going to duckbill palpate for the kidney, and I do not feel that, and I do not feel that there either. So now we have palpated and listened to and percussed everywhere in your belly. So while you're here as well, since we're in a limited space, I'm going to assess your hip strength. So can you... I did. I went all the way through, and then I put them back in aorta.
Okay.
Okay, can you raise your leg for me? Good. I'm going to hold it up for 5 seconds. We'll check pronator drift while we're here. All right. And then can you rub your heel to your shin? This heel to this shin while it was raised. There we go. And bend your knee. There you go. Heel to shin. Good. Yep. Run your heel down. There you go. Like a can girl, but up and down your leg. There you go. And then now this side, can you do heel to, good. And now run it down. Very good. Okay, so raise this one up and don't let me push. Good. And then raise this one up and don't let me push. Okay, good. So that we were just testing your hip function. We'll do some more when you sit up, but that one's just easier to do while you're laying down. So let me have you sit up again. And now we're going to, yep, thank you. Okay, so we did, all right, we did anterior and posterior chest. We did the bowels. We did a little bit into the inguinal lymph nodes, but I do need to check now your upper extremities and your musculoskeletal system. So we noted that. I'm going to palpate along the clavicular border into the acromion process. And any pain while I'm palpating here, the arms are symmetric. There are no, what do you call them? Deformities yeah, deformities. That was the word I was looking for. Thank you. You have beautiful veins. Yep, there are not any, what the nodes are in osteoarthritis. You don't have any arthritis. And do you have any pain as I feel through here? Any pain? No? So let me go back to your shoulders and we're going to assess the range of motion of your shoulders. So can you flexion and up and then down? That's adduction. And we're going to reach across for adduction. We're dancing. Good. And then can you do this? This is flexion, extension, and internal and external rotation. And then same thing here. Very good. You're very limber for 89. Okay, and then relax. Let's see. So we did Epley's, which, and then we did adduction. Oh, and then did we go up and across? There we go. Okay, and then up and across. It's like a dance move. Okay, so now we're going to bend your elbows up and let's assess the strength. There you go, and then push out. Good, that's 5/5 strength. And can you supinate and pronate like this? Good. And then while you're holding your arm like this, I'm gonna palpate any pain at your medial or lateral epicondyle. And I'm going to assess your reflexes. We're going to start with this arm right here. Oh, thank you. And then let me just have you relax that arm right here. And we're going to check your tricep. Go ahead, relax your arm. Okay. And then, nope, stay relaxed. And here we're checking. That's your radial stylus right here. And this is your, there we go. I saw it. And then we're going to, did you? And then we're going to assess your, go ahead and relax. Relax your brachial. Good. That was a good one too. And I'm going to assess your epitrochlear lymph node, your axillary lymph node, which goes right into your armpit. I won't push too hard. Axillary lymph node. And then I'm checking into your pectoral lymph nodes, and I don't see any. I'm checking with two hands, your posterior axial lymph nodes and into your anterior ones. Okay, good. And I'm assessing your brachial pulse, which is 2+, your radial pulse, which is 2+, your ulnar pulse, which is 2+. And tell me, is this sharp or dull? Sharp or dull?
Dull.
Dull?
Sharp.
It was sharp? Okay. Sharp or dull? That's dull. And this is sharp.
Yes.
Can you tell the difference?
Yes. Yes.
Do you have any, okay, so let's see. This is your, you feel that?
Uh-huh.
Okay. And you feel that?
Yes.
Okay. And then, how about here?
Yes.
So that's your radial, ulnar, and medial nerve. And then when I tap here, any pain or numbness or tingling? Okay, now let's assess the other side. Okay, thank you. And then again here, I'm going to have you relax your arm across mine like that. And yep, just relax. It's your tricep. And then be cute, yep, just like that. Radial. And now we're checking this one. Relax. Good, that was a good one. And then sharp or dull?
Dull.
Sharp or dull? Okay. That's dull. And this one, do you feel?
Sure.
Okay. And then, what was that doing? I did all of those assessments. I did all of those reflexes. What did I do over there? Oh, your pulses and your epitrochlear lymph nodes. Okay, epitrochlear, brachial pulse. Holding your arm like a banjo. And then that one. Any, when you relax your hand here, any numbness or tingling? Okay, good. And then let's check your axillary lymph node. It goes right up into there. Your posterior. And your anterior lymph nodes. Okay, and then I already assessed your epitrochlear. So go ahead and relax, and then let me come back to in front of you.
Can you back with abdomen? Did you assess with Bernie's point?
Yes. Right after Murphy's. Didn't I? Or did I?
I didn't hear you.
I don't think I did actually. I might have missed McBurney's point.
What about femoral pulses?
Yes, I did those.
CVA tenderness, like the CVA.
I didn't do CVAs yet, but I can do that right now actually. When you sat up, that's when I meant to do the CVA.
Yeah.
It's a weird
It is hard.
configuration. Well, let me do that really quick. Thanks for reminding me though. Any tenderness when I do a little tappy tap? Okay, good. All right, so back to your fingers. So show me your fingers. Can you reel it, wide them out, and then bring them in? Excuse me, can you please? Okay, and then go ahead and grab my fingers. Yep, and just get a little squeeze and release. Good. So do this one again. Can you squeeze them? Squeeze them hard. Can you not bend this finger?
This one's hurt.
What happened?
I had an accident.
How long ago?
About a year and a half.
Did you fall?
I picked a plant up trying to hang it on a hook, and it pulled something in here, and the hand specialist wanted to do surgery. He said I busted some nerve or some little muscle that's holding that, and he said I could put something, I could correct it a bit, but I can't guarantee it. You'll have to work it.
Oh.
And I said, I don't want the surgery. I'll live with it.
Okay. I do notice it's a little more swollen than your other right in here.
No, that
it's a little more swollen.
that's my hurt. And I can't open jars anymore with this one.
Yeah, your grip strength was weaker in that right hand. I would say like a 2, or I'm sorry, a 3 or a 4, where this one was a 5, over 5. Okay, so that was your grip strength. But wait, I had another thought. Oh, and then Fallon's sign, any numbness. You had carpal tunnel surgery, so is this fixed for you? If you push against, does it have any? Okay, that's okay. Did it hurt?
A little bit on this one.
Okay, so we'll just stop that. Okay, so now let me go to your, where'd my doodad go? My reflex hammer.
Yeah.
Oh, here it is. Okay. All right, so now we're gonna assess your,
Go.
Can you go ahead and kick, yep, that, oh, wait, one more thing with your arms, I'm sorry. Pronator drift. So hold them out like you're holding a pizza, and we'll close your eyes, and we're looking for pronator drift for 10 seconds. Very good. And then go ahead and relax, and with that hand, can you touch your nose? And then I'll touch my finger. Touch your nose. Touch your nose.
Oh.
And now touch my finger. Good. And back to your nose. And to my finger. Good. So you got a normal finger to nose test. And now we're gonna assess your knee reflexes. So yep, just relax. You can relax it and I'll hold, yep. Okay. And your Achilles. So we checked the patellar and yep, felt that one. And the Achilles. Okay, good. So we did did we do that? Can you pull back and then push out? Good. Okay. So that was good 5/5 strength of the knees. Now we're going to look at your toes. Can you spread them wide? Oh, do you have a little swelling here in your ankles? A little dependent edema from sitting for a while? Okay, but the color and texture is good. There's no purpuric lesions, rashes noted, but there is some pitting edema, about a 1+. Let me check your pulses and your dorsalis pedis, your posterior tibial, and close your eyes, Auntie Olga.
Mm-hmm.
Which toe am I touching?
The big one.
And is it going up or down?
Down.
Okay, and now?
Up.
Okay, good. She's got hair on her toes, which means good peripheral circulation. And then can you spread your toes out wide?
Mm-mm.
Okay, that's okay. I can see that you're doing it. And then bring them together. Can you try to turn your pinkies to the floor? Pinkies down, and then your big toes down. Okay, roll your ankle in a circle. There you go. And the other one? Good. Okay. Varus Vargas is one that I didn't do with your hip while you were laying down, but can you try to lift that hip up and move it inward? Good. And then same thing with your other one and move it inward. Perfect. Also while you're laying, oh yeah.
Did you put it back?
Yeah. And then is this sharp or dull?
Sharp. Dull. Sharp.
Okay.
Sharp. Sharp. Sharp.
Yes. Okay. Any numbness or tingling down your legs or anything like that? Okay, here, yeah, let's put your socks back on. Okay.
Thank you. Slipper socks.
Yeah.
Have to have warm feet.
Yes. Do you get cold extremities? You do?
A little bit.
Okay. So now I'm going to have you stand up and I'm going to look at your spine. All right. And I am palpating your cervical spine for any step off, any tenderness noted.
No.
Okay. And then can you bend over and touch your toes? There's no asymmetry. Wait one more time and hold it there for a second. Good. Okay, stand up. No scoliosis. Your there's a little asymmetry here. The right shoulder is a little lower down than the left. Hips are equal. So now we're going to check your cervical motion. Can you look your left? Yep, chin to shoulder. Look this way. Good. And then back to center. And then look over here. Good. And then back to center. And then touch your ear to your shoulder like this. Here, I'll face you. Let me face you. There we go. Ear to shoulder, chin to chest, and then eye to eye. Any pain? You've got good range of motion. And now we're going to do that with your thoracic spine. Try to do just your spine only. Lateral bending. Good. And then can you flexed forward and showed me already a little, and then backward. Good. And now let's do your lower spine, hips to the side. Good. More dance moves. Yeah, more dance moves.
Merengue?
Yeah. and back. Okay, and then now I'm gonna have you close your eyes, and we're gonna do a Romberg test. Close your eyes and stand still. She also has
A little left drift.
a little left tilt, but that's normal. If you were, my teacher had an inner ear canal or infection, I think, and she showed us her Romberg and it was positive. Okay, Bentley, move. I'm gonna have you walk to the other side of the room normally. Good. She's got good mobility and a normal steady gait. And now on the way back, do heel to toe. Heel to toe. Very good.
Yeah. I can't do that.
Okay. Do you ever feel off balance or dizzy?
A
You
little
do?
bit.
A little bit? Okay, go ahead and have a seat again. One more thing. We got to do the extension backwards on the hips because we didn't do that because we were laying down.
Go lay down.
So
Bentley,
your leg backwards, like your,
come here.
yep,
Lay down.
your heel, like this.
Okay.
No.
Yeah. Yep, good. And then the other leg. Good, you did it.
Bend 3 in the way.
Okay. And then go ahead and have a seat back down. And after all that, I think you need to go see an audiologist. Have you had?
Are you kidding?
On respiratory, I don't remember seeing or hearing probably for tactile from this.
Yes, we did 99 on the front and the back.
Should I put this back on?